Good morning, everybody. This is Bill Ellsworth, Equitable Life and Casualty. Appreciate you joining us here today. Want to kind of give everybody an update on where Equitable's rates are stacking up here now that we've had our first rate increase on our release of our product that we sent out on, I believe, February of last year. Never had that happen before. I just had a webcam pop up on my screen. That kind of threw me off base there. But anyway, again, thank you for joining us. If you have any questions as we move through here, I have Rashawn Georges on the other end. She will answer those as we move through. So let's go ahead and move through these rates and talk a little bit about our Express app process here in just a minute. We also want to introduce you to our household discount. We had that in a few states last year. We'll show you where we have added that for this coming selling season and give you some competitive comparisons on where, even with a rate increase, we'll show you where we are still stacking up in the marketplace today, and then just some quick pointers on the Express application process. If you're new to Equitable and this is one of your first webinars that you've listened to, be sure and keep checking your email. We do Express application webinars on nothing but the Express app process on a regular basis. Great process, and we're one of the only companies that have a true instant answer Express app process. Okay, so right now, if you look at the screen there, you'll see the states that we are currently offering a Medicare Supplement product. Now, as usual, I would love to tell you we're in the top chair in all of those states. We are not, but I guarantee you in a lot of those states we are in the number 1 or 2 chair and extremely competitive product in a lot of those states. So we are doing our best to keep you in front of your customers and give you a great product with back office support second to none. Right now, if you look at the map, you'll see 6 little yellow stars on there that we currently offer. Well, this is where we started out in February of 2013. These states offered a household discount, and it was a 7% discount. 2 people had to apply. So, you know, we got some very good business out of those states, but we wanted to do some things different for 2014, so we added some more states. Now you're going to notice you'll see yellow stars and a few red stars. Well, there's 4 states, Illinois, Virginia, North Carolina, South Carolina, that have red stars on those. And the reason that we have done this is we are doing some kind of trial marketing with these 4 states, and instead of 2 people having to apply, only 1 person needs to apply in those 4 states. As a salesperson for over 30 years selling Medicare Supplement, I'm here to tell you that gives you an advantage in the sales field, and then I think you'll understand why when we go through some of these guidelines. So let's take a look at where 2 people must apply and how the discount works. We have a 7% discount. Let me go back real quick. So we're going to talk about all the states that are in yellow right now. So for the 2 people that must apply, if you're living in Nebraska, Oklahoma, Texas, 2 people have to apply in those states, and here's how the guidelines work. Notice it's a household discount, not a marriage discount. A 7% household discount is available to applicants living in the same household. Marriage is not a requirement. A policy must be issued to both applicants to qualify for that discount. So if you have 2 people apply, 1 person gets declined, the discount will not apply for the other person. Now, we introduced these initial 6 states, and now we've introduced a few more to where the 2 people have to apply, but that original launch date was February the 11th, 2013. So the household discount is available for applicants dated on or after February the 11th, 2013, or the date the household discount is introduced in your state. So you can still get the discount if you have a yellow, if you're in a state that had the yellow star on it. That discount can be added to existing policies. Both policies must be issued with the rate structure introduced in February of 2013 or later. So if your client has an existing Medicare Supplement policy with Equitable, to qualify for that household discount, they must submit a new application and pass underwriting. Once that policy is approved, the household discount can be applied. Now, we get quite a bit of questions on this, so let me just give you an example of why they have to reapply. Let's say back in March of 2013, you sold a man a policy, and his wife was not going to be 65 or eligible for Medicare until about this time this year. Here's why we're going to make him go back and requalify for them to get the discount if you're in a state where 2 people must apply. Let's say that in November of last year, the man had severe kidney problems and went on kidney dialysis. That, guys, is a very, very expensive claim, and no company doing business would go ahead and reduce and give him a discount on his premium, because he's sending claims in that are going to be about $3,000 or $4,000 every month for the rest of his life as long as he's on kidney dialysis. So that's why we won't just go ahead and make it effective if the second person applies and gets the discount. They both have to reapply to get the discount, because the people we sold last year, some of those people are very ill now, and we're not going to go ahead and jeopardize the rate for the rest of the class by doing something like that. So they both have to reapply. They both have to get the dates or the new rates. So if you have any questions on that, go ahead and we'll get those answered again more in depth at the end of the webinar. Okay, if you live in Illinois, North Carolina, South Carolina, and Virginia, only one person needs to apply. Now, last year, Illinois, both people had to apply. So we got that approved in Illinois to only one person has to apply, and that really is a boom for those guys up there. So a 7% discount, again, is available to applicants living in the same household. Again, only one person has to apply. Marriage is not a requirement, and it's available to new applicants with applications dates on or effective after April the 1st of this year. Existing policyholders, again, will need to reapply to receive the discount. So let me go back to my kidney dialysis example in the first place. Say that you sold that to a guy back in 2013, and we introduced this only one need to apply. Again, if he can't be approved underwriting, we wouldn't reduce his premium. But if he was very healthy and we have only one need apply, and say his wife's not going to be 65 for 3 or 4 more years, he can submit a new application. If he's approved, then we will reduce his premium. So we have to protect the rate structure and the integrity of the rate by putting these types of guidelines out there. The discount is capped to apply to where there is a minimum of 2 people in the household and a maximum of 5 in the household. That kind of protects us from an agent going into an assisted living facility and saying, oh, well, there's 100 people that live in here, so I can go ahead and give you the discount. Only, and at least that one person in the household has to be at least 30 years old. So stop and think about it if you're in Illinois, North Carolina, South Carolina, or Virginia. You go into a situation to where a man is turning 65 and he tells you, yes, I am going to be 65 in June. My wife will be 65 2 years from now. That man qualifies for a 7% discount. And when you look at the rate increase we had versus the discount, you're going to like what the rates look like here very shortly. Guys, there's two really main drivers of Medicare Supplement selling for agents. Number one is they got to have a competitive rate and a fair commission, as number 2 is a fair commission. So when you add our Express App process, that's our third advantage. And when you add the tremendous back office support you get through Equitable, that's 4 good selling points for this company to take care of you, our agent field force. I've been with Equitable since 1989, I believe, and I've got contracts with Mutual, United Healthcare, Coventry, you name it, I'm contracted with them. Nobody has ever treated me or my policyholders better than what Equitable does. So great company to do business with, and we're doing all we can from the home office standpoint to keep you guys in a competitive selling advantage. Okay, here are the states to where we had a rate increase in 2014. If you are looking at a yellow state, that rate increase went into effect on April the 1st of this year. If you're in Idaho or Louisiana, that rate increase took effect 5/1 of this year. And if you want to take a look at how much of a rate increase we had, you can see pretty darn mild across the board. If you add all the percentages on the rate increase up and divide them by the number of states listed, we're coming in at just a shade under 5.2. I think it's actually 5.19%. So extremely competitive rate increases. I've been in this business a long time, and I'm here to tell you, customers don't get upset. Like if they're in Nebraska and they get a 4% rate increase, they're going to attribute that to inflation and say, oh, that's not too bad. That's mild. If I had a $100 premium and now I'm $104. They don't start jumping ship for these types of rate increases. So we're doing everything we can to hold your clients to where you keep growing that residual commission. If you look in North Carolina had a 5% rate increase. We'll stop and think about that. A 5% rate increase, a 7% discount. When I show the existing rates compared to where they were last year versus where they're at this year, you'll see a turning 65-year-old female will actually get a lower rate this year than she got last year. So again, we're doing everything we can to keep you guys in the forefront of this market. So let's go ahead and look at some of the rates. If you look at Iowa, the monthly rate for the state of Iowa, we're coming in at $87.65. That took effect on 4/1 of this year. Continental, which is a Netna company now, is at $97.71. They introduced that rate in June of 2013. Arlic, or Cigna, they are at $99.13. If a lot of you guys are selling for Cigna, you'd also notice they're having a across-the-board rate increase of 8% on all their business. And if I, have to say 8%'s not bad, but 8%'s not as good as 5. So that, if you start compounding that out over a couple of years, you'll see that does make a huge difference. They had a rate increase in Iowa effective on, I think it's effective 5/17. So that rate increase, yes, I'm looking at my sheet here. Iowa goes up 8% on 5/17 of this year. So add 5% to that, they're going to be coming in at about $105. So in Iowa, 2 people have to apply to get the discount. And guys, I'm here to tell you, you got a great, great product there in front of you. So moving right along, Illinois, another state to where we want to talk a little bit about where that rate is effective. If you look at Illinois as on the map and find about where Chicago would come in at, most companies are rating the quadrant outside of Chicago metropolitan area as the same rate as the people inside of Chicago. And we do not do that. We just got kind of, if you could take a little pencil and, just draw the outlying areas of Chicago and black that out, and then go to the left of that, that's where this rate really, really stands out. Stop and look at that, 118.57 versus 130 with combined, 131 with mutual. And all of those rates, if you look at the dates, 1/1/14 for combined, mutual on 4/1/13, so they could possibly be looking at even going up. Oxford and Arlic, again, probably going to have a rate increase there. Well, I know Arlic had a 8% rate increase as of March the 1st, so add 8% to that 134, and guys, I'm here to tell you that is a good discount, especially Illinois being a state to where we only have to have one person apply to get that discount. We think, from what we've looked at actuarially, when only one person need to apply to get the discount, we think that's going to let you offer this 7% discount to approximately 70% of the people that you talk to. That's huge. I mean, that's a really, really good advantage for our sales force. Kentucky, another state that we are very, very competitive in. We are looking at about 104.32 for a female turning 65. Let me go back here real quick. All of these rates, folks, are based on a 65-year-old female, age 65, non-smoker in the lowest area factor. I've got that right down there at the bottom, but I do want to clarify that. So when I'm looking at a combined rate or an Arlic rate, that also is a 65-year-old female in their lowest area factor in that state. So we're doing a, an apple-for-apple comparison here. We want to, be fair to all the other companies out there. They're good companies. But 104.32, very, very strong rate with Equitable. We are looking at that rate that went into effect on 4/1 of this year. So very, very competitive in the state of Kentucky. If you need any of these slides on when these rate increases took effect, guys, all you got to do is just shoot Rashawn an email, and we will get those out to you, or just, in your questions there where you can type that in the box there, type that in and have her send you the slides on all of this. We can do that, and we'll see what we can to help you out. Okay, Michigan. Michigan's a little bit different state for us. We took a lot of business out of there last year. I think we'll do as well as we did last year. Just to give you an idea, last year Equitable had a record-breaking year for Medicare Supplement production. I just looked at my screen yesterday. We wrote 153,000 just in yesterday alone. So we are still seeing the business come through. I think we're on about a 15 to 20% uptick in premium over last year's record-setting year. So we do appreciate everything you guys are doing out there. You are doing a great job. And again, as a company, they are trying to hold these rates and give you incentives to keep you in the forefront of this marketplace. So in Michigan, we're coming in at about a 114.71 rate. That does include the discount factor. So if you are in Michigan with the two people and getting the discount, hopefully we'll keep you in the driver's seat there for another year or two to come with this rate. Mississippi. We're coming in very strong in Mississippi. We are looking at $100.75 for a female 65-year-old, lowest area factor. That rate was approved on, again, April the 1st. And if you look at our competition there, even without the discount, if you take the discount off, we'd be sitting in the #1 slot right there. So again, in Mississippi, we are extremely competitive. I'm just looking on my list here for ARLIC. Doesn't show them. Yeah, they're having a rate increase in Mississippi effective on 5/1. So they've already had that rate increase. Add 8% to that $100, and you're adding another $8, $9 a month to that. So that's going to stick them in about 116, somewhere in that ballpark for a turning 65 female. So guys, rates drive Medicare Supplement production. But holding the rates keep your residual commission coming in year after year after year. Keep in mind, in a lot of states that are issue age states, there's several of those out there, some are attained age, but when you're in an issue age state, if you sell a policy at age 65 and we hold rates down for 2, 3, 4 years that are very, very moderate rate increases, when anybody else comes in and tries to replace your business, they got to go 2 or 3 years down the road on their new age to where we're still getting them the 65-year-old rate when they applied. So a lot of factors drive Medicare Supplement retention, and we're doing, again, as much as we can to keep you guys out there in good shape. North Carolina was our #1 producing state last year. We took a little over $4 million out of the state of North Carolina. I do believe this year we will take over $6 million out of that state. We are on target to do that. And last year, this is what I was talking about earlier, last year the monthly rate for North Carolina for a turning 65-year-old female, North Carolina did not have the discount. It was $105.50. This year, if you walk into a lady's house and she's 65 and say her husband's in bad health, or she's turning 65, her husband's in bad health, and maybe he's got a Mutual of Omaha policy, you can still offer her this discount even though he does not apply. And that means this year you can offer a Plan F Medicare Supplement for about $1.50, $2 less than we sold it last year. Guys, that's huge. I mean, it just really is a good situation to be in. ARLIC in North Carolina, I do not know. Let me look here. No rate increase in North Carolina yet for them. So that may be coming here shortly. It's usually 12 to 13 months after if they're going to file, but we're in extremely good shape in North Carolina. And again, the business is really, really rolling in. So if you're in North Carolina or selling in North Carolina, again, great job. We do appreciate you. Nebraska, you know, that's Mutual of Omaha's home state. I really figured we would not be competitive in Nebraska to what Mutual would have, but we are taking, Nebraska was in our top 10 last year in state production, And again, the business is coming in the state of Nebraska on a regular basis. If you look at that rate at 95.35, you'll understand why. Still a good rate. Oxford, I know, has got to be going up shortly. May have already done that. I just need to check my data. But we're in very, very good shape in Nebraska. Now on 4/1/14, the rate did go up, and then we offered the 7% discount. So in better shape in Nebraska this year if they get the discount than they were last year. New Mexico, small state as far as production goes, but a good state for us. Again, we are looking at a price of $100 for a turning 65 female. That was effective 4/1, so again, doing quite well in the state of New Mexico for a small state for us, but we think you guys could do quite well in New Mexico. Now, that's a state that we don't offer any discount at all, so if you take a look at that, that rate is that is not a reduced rate, that is the actual rate. So looking for a lot of good production coming out of the state of New Mexico again this year. Oklahoma, a lot of competition in the state of Oklahoma. That's the home state for a company called Old Surety, but they still are not having as good a rate there as what we do. We have a lot of business coming out of the state of Oklahoma. 94.16 for a turning 65-year-old female, and then one of the better, stronger competitors we have in Oklahoma, of course, is Arlic or Cigna, and they had a 5% rate increase scheduled for 5/1. My slide's not updated yet, so round that off to 100, add about $4 to it, you're at about 102.3, somewhere in that ballpark. So if you take a look at that, that's going to give us about a $7, $8 a month advantage over them. And again, if you take two people that qualify for that, and it's $8 a month cheaper, that's $16 for the two. You're looking at a couple $100 a year less money for an individual couple, and that is money in their pocket. They're getting the same apple for $200 a year less. Great opportunity in Oklahoma. Oklahoma was the top producing state for us also last year.
Bill, it's Kevin. Can I chime in here for a second?
Sure.
Bill, give you a break and chime in. I want to emphasize something that you're talking about here with regard to rates. And, we have a 4% rate change, especially in Oklahoma. Go back to Oklahoma, people. Well, actually, this slide's okay. South Carolina is fine. If you look at our rates are effective 4/1. We had about a 4% rate change in many states. And if you take that over time for your clients, the importance of having a low rate now and a low rate increase over time, it makes a huge difference to your clients. There's other companies like Arlic and a few other companies that have lower rates, but if they're taking 8% rate changes every year over 3 or 4 years, their rates are going up 28, 29%, or our rates are going up 12%. So you have a better chance of keeping your Equitable business, your renewal business, and your clients, and earn additional business from their referrals. So the way we're doing our rates right now is so important now with a lower rate, a good rate, and in the future, as you grow those rates, we're still going to be much better off in the long run. Your clients will be with us over many of the companies out there. And there's many fine companies, as Bill was talking about. But on a rate standpoint, on an apples-to-apples comparison, your client's better off with us. So I just wanted to chime in and emphasize that point to you or make it, Bill.
Yeah, and guys, like I said, I've been selling MedSup for 30 years, and back when I first started out with Larry Barnes' agency in Trenton, Missouri, worked there for 5 years, went out on my own, and I took a contract with Christian Fidelity in 1989. I had a customer pass away just the other day, and I went back and looked at his effective date. He had that same Christian Fidelity policy for 22 years. Now, there was other policies out there that were less money, but not a whole lot, and he was so comfortable with the way Christian Fidelity had taken care of him over the years, you couldn't have pried that out of his hands. I mean, he loved it, and you go down the road 10 years from the day he had it, and he bought it at age 65, so now anybody coming in is going to quote him at 75, and even if they were $1 or $2 cheaper, he wasn't going to change for that. I mean, he knew what Christian Fidelity was, and that's the same concept I'm trying to get across here with the Equitable. By having trend or below rate increases, and if you're in a med sup business, you're going to have rate increases. You've got to get used to it. And we know that if we can hold these rate increases and do a good job of underwriting and take care of your policyholders keep renewing, and you keep getting a good residual comp off of that. So that's our goal, is not just to take care of the company. As Rod Ross used to always say, they base their philosophy on the pyramid, and on pyramid you got 3 points, and it's got to be good for the company, it's got to be good for the policyholder, and it's got to be good for the agent. Unlike Medicare Advantage, stop and think about people who sell Medicare Advantage, and I sell Medicare Advantage. You've got to sell Medicare Advantage if you're in the senior market. Excuse me. But stop and think of the customer service that you get from a Medicare Supplement carrier such as Equitable versus the customer service you as an agent will get on a Medicare Advantage plan. Once you sell a Medicare Advantage enrollment, they don't want you having anything to do with that policyholder at that point. They look at that as that's their policyholder, and you should stay the hell away from it and just stay out of it. I wasn't raised that way. I was raised and trained that if I sell a product to a policyholder, I want them to call me if there's a problem. A lot of times it's something I can fix, and that's why I get paid residual commission, to offer my service and the company's service to them. So you're not going to find anybody any better than Equitable Life and Casualty when it comes to taking care of policyholders and when it comes to doing moral decisions like paying a claim that maybe shouldn't be paid. I've seen them do that before, or maybe refunding the policyholders money after they're out of the 30-day residual or 30-day free look period. If it's truly in the customer's best interest, they're going to go ahead and take care of your policyholder so that that does not ruin your relationship with that policyholder. So just a great company, and again, they're doing everything they can from the back office to keep you and I out in the front. Okay, South Carolina, moving right along here. South Carolina, again, only one person need to apply to receive the discount, and again, we think that'll affect about 70% of the people that you talk to. So if you take a look at Equitable's rate at 102.93, and you take a look at Arlic, they're coming in at 105.84, and I do believe South Carolina's on the list here for a rate increase, but I'm not 100% sure. But even if not, we're still in the same ballpark with them. And when you add the competitive advantage that we give with the telephonic app, which we'll talk about shortly here in just a minute, I think you'll see why business continues to roll in from South Carolina and all the other states in which we're in. Virginia, another state in which we only one person has to apply, and we're seeing an uptick in premium in Virginia. When we introduced this only one person discount availability, we're coming in at 92.07. And that's a very, very good rate in the state of Virginia. We are looking at, we introduced that on 4/1, and Arlic's coming in at 94.30, and they will be coming out with their rate increase here pretty shortly. Omaha Insurance, which is another sideline of Mutual of Omaha, is already at 104.43, and they've been living with that rate for a year and probably almost 6 months, so we know has to go up soon. So guys, if you're in Virginia, you're in a great, great spot to market our product. West Virginia, we're at 102.92. You know, West Virginia is kind of a state to where there's some poverty issues, but we are getting some very, very good business out of that state. West Virginia is a beautiful state. I love it. Got good friends there. And they're coming in at 101.92, and Arlic is coming in at 107.60, combined at 111, and if you go down to Continental, they're at 113.87, and I know with almost a year and a half at that rate, they have to go up higher than that shortly. So, guys, that is a list of most of the states. That's not all the states, but I don't want to bore you to death with all these other states. If you're listening from a state that I haven't put on the map, if you have questions, by all means, shoot them in and shoot us an email or something. We'll respond, get back to you, and get what you need taken care of. Want to real quickly talk a little bit about the Express app and, just kind of cover a few things here with you. I want to give you a continuing reason to use this Express app process. I'm not going to go clear through all the mechanics and processes, but basically what I want to do is let you look at that map while I talk about the Express app. If you go back and you talk about, a lot of these companies out there are talking about, well, yeah, we got a phone app process. Yes, they do. You call in on a phone. They do a little bit of the information, taking the information, and then about another week to 10 days, you find out whether your policyholders approved or, declined. A couple of highlights that I want to go over real quick, and then I'll let you guys get back to your day. The good thing about the Express app is you don't make any mistakes. When you call in, the underwriting department's going to take that app in full. They're going to log every required field. They can't move from one required field to the next field unless that is logged in there. So you don't forget anything. You don't have to go back and get pending items to get a policy issued. And if you're doing an open enrollment case or a guarantee issue case, you're going to have about a 15-minute phone call. It's going to be mainly the primary information. They're going to skip a lot of the underwriting. Well, they'll skip all the underwriting and medications list, and that'll speed that process up. But I always tell guys, if you're doing a fully underwritten Express application, expect 20 to 25 minutes. That a lot depends on how well your policyholder can hear, how well they comprehend, and how well you prepare them. If you need a cheat sheet for that, I have one for you. I usually email that out on the Express webinar when I just do it on the Express application. And the cheat sheet is not, again, something to get a policy issued, to hide something. It's a cheat sheet to make sure the client and you are prepared for the interview. Things like making sure they have their information available for Social Security, something we're going to ask. Their Medicare number, we're going to need that. If it's an underwritten application, we got to have all their medications, so make sure they got their prescriptions in front of them so that they can, identify what that is and what it's for. Make sure they have their doctor's name and address. Make sure they have their banking information in front of them. Because every time we ask something like that, if they have to get up and go get it, that frustrates them, that frustrates you, that slows down the interview process. So be prepared, and your Express applications will be extremely smooth. So just a couple of quick things here to touch on, and then I'll let you guys go. The good thing with our tele-app or Express app process, guys, is there's no guessing at the end of this interview. You know whether the policy is issued, you know whether it's declined. So if you do get a decline, which I've had happen once or twice, isn't it better for you and I to know right then on the spot, if you're sitting there at the kitchen table with your policyholder and we say, no, Bill, we can't issue this, that I put that back in my briefcase and I'll say, you know what, Ms. Jones, it doesn't look like we're going to qualify for the underwriting guidelines. However, I've got a couple other things I can look at here. AARP's very competitive here also, not as competitive as Equitable, but a lot more liberal in the underwriting. Let's take a look at that. That's a lot better for you. That's a lot better for the client. Instead of finding out 2 weeks later, then you got to try to get back in front of that policyholder. Maybe they've went ahead and paid their other premium, or then you have to drive back to their house and resell the same thing that you thought was already going to generate a commission for you. So a great opportunity to find out immediately whether they're issued or whether they're declined. But stop and think about this. When the policyholder gets approved and the underwriter says, okay, Ms. Jones, hand the phone back to your agent, and you take that phone at that point, put it on speaker to where the client can hear the next part of this conversation that you're having with the underwriter, and the underwriter says, Bill, your policy is approved. It's going to be effective June the 1st. Here is your policy number, and they read you the policy number and you write it down, and then you read that back to the underwriter and you say maybe, hey, Jose, so I'm going to have a June 1 effective date. My policy number is 2896344, and my premium is $105.50, and I'm good to go, correct? No waiting period, anything at all like that. No, everything's fine. Everything's in order. Thanks, Jose. You hang up. Your policyholder just heard that with their own ears. You can eliminate buyer's remorse, and just a great, great process. One other thing that I'm going to jump off of here, think about moving down to the end of the month to where we're at, say, April or May the 28th, and you're sitting there talking to an individual, and he has a huge rate increase with XYZ company effective June the 1st. He likes your product. He's in good health, but he's worried about having to pay that rate increase taking effect in June. You now have the ability to get on a telephone, get it underwritten, get him in a June 1 effective date, and once he knows he's approved, then you don't have to wait to cancel his other insurance. At that point, once you have approval from Equitable, you simply say, okay, Mr. Jones, get your ID card out. Let's call your current carrier and tell them not to draft your bank account in June. You just become a hero in front of your client's eyes, because if they've been in the Medicare Supplement market, they've probably been in a situation to where they had to pay rate increases for a couple of months trying to get another policy in place. So with that said, guys, that's about all I've got. I'm going to look at this map again in the 4 states. Got to get one other. I got to get North Carolina turned red there. It's still yellow on this slide. So let me get that corrected here for the next webinar. But even though it shows you North Carolina is a yellow star in front of you right there, North Carolina has a red star on it. Only one person have to apply in North Carolina. Okay.
Bill, this is Kevin. Can I jump in here on that?
Kevin who? Oh, Kevin Williams, yeah. Go ahead.
Hey, I want to emphasize what Bill's talking about with regard to, if you haven't, number one, used us, just try us out. And if you haven't used our express application, give it a try, because it's been my experience through the 6 or 7 years we've been offering this type of program, the agents that try it all of a sudden say, well, this is really cool. And especially, as Bill was pointing out, if you can sit at your house and do this, you don't have to visit your clients. So if you're in Chicago and have a client in Springfield, or if you're in, in Utah, in Salt Lake City, and you have a client in St. George, I mean, those are 6-7 hour drives. Pick up the phone, sell it over the phone, especially if you have replacement business where somebody's got some rate increases. So think of a couple of clients and just give it a try. And I think you're going to find that, wow, this really does work out well. That's all I wanted to emphasize, Bill.
With what he just said, let me just read an email I got from a guy by the name of John Skinner, and I believe John's from Oklahoma. And he said, hey, Bill, just wanted to drop you a line and say thanks for the webinar. I just completed my first telesales process. I just helped a client in Veneta, Oklahoma, 2.5 hours away from me with this. We hadn't been able for a month now to be able to get together and get her supplement taken care of, and this went smooth as silk, and it took about 20 minutes over the phone. This is an excellent tool. It saved us both a lot of time, and she now is saving $71.36 a month on her supplement premiums. So John, done in 20 minutes. If you'd had to drive 2.5 hours to her house, that would have been over 5 hours round trip just in driving. Think of the expense on the mileage, and he accomplished it in 20 minutes. Guys, I'm telling you, just as Kevin said, if you have not tried this process, kick the tires and take her for a spin. I think you'll like it. I tell you, I love it. It is such a time-consuming and money-saving deal for you guys out there in the sales field. Right now, probably about 60% of most of the business being written through this company is over the telephone. And that is huge for us as a company when it comes to paperwork. It's huge for you. And again, we are still, working on perfecting the process, which is, I think, pretty smooth the way it is. Tele-underwriting hours, Monday through Thursday, 12 hours in every time zone. On Friday, 11 hours in each time zone. The underwriting hotline number is 866-551-1781. Fax number is right below that. Information right there for Equitable. They're located in Salt Lake City, Utah. And you guys probably have most of these numbers. If not, let us know. We can get them to you. Again, my name is Bill Ellsworth. I'm your presenter. Kevin, who's been talking with you there a little bit, is our National Sales Director. And then we have Todd, Cindy, Glenda, and Amy also. So I'm going to leave that slide on there. It'll stay up for a little while after we say goodbye. and that way if you can get those emails, give us a call. We'll help you any way we can. So, guys, that said, I'm going to jump off of here. Appreciate you giving me time to visit with you. If we can do anything, by all means, let us know. Have a great day. Bye.